City of Franklin Board of Health meeting to order, January 8th, 2024. Happy New Year, everybody. First thing, roll call, Amy and Deborah are excused, and Dr. Rudlevich is not here at this time. Everybody else is present. We need approval of the minutes from November.
So move.
Second.
Any discussion? All in favor?
Aye.
Okay. There are no citizens for any comment period. Do we have any unfinished business?
We do not.
We do not, so we'll go right into new business. And administrative updates. Do we have interns?
We do have interns, so
Okay.
that's the main update of today. So we went and took that request to council to sign agreements with both Medical College of Wisconsin and La Crosse. So we have our student agreement signed with them. So we have an 80-hour student intern from the Medical College who's currently enrolled for her Master's of Public Health. And both students will concurrently be doing it from January through May. That's the cycle they both run on. But our MCW student, Hayden, is 80 hours in that whole time, so much smaller than Lindsay's, whose is 560 hours.
Wow.
And she's our undergraduate student from the University of Wisconsin La Crosse in the community health program. So Lindsay's first day was today, so that was wonderful. Alan Henry is one of her main site advisors, and she's going to do a lot of work with Megan Conway as well with Volition. But some of the other things she's going to work on is media management and updates for Volition Franklin's website, some work with our community health assessment, dabbling in nutrition work, and then I'm sure she'll be involved with the park audits that the health department's working on just to ensure accessibility for all when possible at the parks. She'll be involved in the spring run. We have our audiovisual screenings coming up, and she'll be involved in that, and then some Volition Franklin initiatives.
No, you said La Crosse. Is she from Milwaukee County?
She is from Milwaukee
Okay.
County, so I just talked to her today, and she grew up, I believe, in Oak Creek, and now is a Franklin resident.
Okay.
So she's back from school, lives in Franklin, so she'll be right down the road, which is great. And then Hayden, our MCW student, also lives in Franklin,
Wow.
which is fun. So she'll be starting more mid-January, and we'll have her available to work with Volition Franklin on smoke-free air, things the youth are really passionate about. We're going to have her do some information gathering from our environmental health specialists in that program, because oftentimes it feels that program kind of hides behind the scenes. Like, that's not one of our forward-facing programs as much as a community event, even though it's happening daily throughout the city of Franklin. So we're trying to work with her and create a project brief essentially for that, to say this is what our environmental health program is, so that anyone can just take a glance at that. And then looking to continue working on inclusive physical activity projects. And given her role at MCW as an audiologist right now, she most likely will assist with our AV screenings in the school system, which are scheduled to will be happening in February. Those are the main administrative updates I have.
Okay. Anything else under administration? Then we'll go into clinical service updates.
All right. So we are back to doing our respiratory report and our general summary of services here. So just to talk about some of the summaries from quarter 4 of 2023, just to keep it simple. There were 10 you'll see quarter 4 listed in the table. So the blood pressure checks are noted, animal bites that we followed up on, which is pretty typical. Like, the summer is more heightened because people are out walking their dogs, playing in parks. And as the months get colder, dogs bites tend to go down. Car seat installations, sharp encounters, which is still a very popular service here. So accepting those used sharps at our front counter in the health department.
Just out of curiosity, I'm sure there's a lot of repeats for that.
Mm-hmm.
How many new?
Oh, that's a good question. I would have to dig deep into that, but gosh, I was going to even try to anecdotally tell you, but it really varies. I would say a lot of people, depending on what size, it depends on what size they take. Sometimes, like one of the most popular things that we get is people that have cleaned out their parents' homes
Oh,
or are moving. And they say, oh, we've had all of these Sharps containers in our house for years. We saw a huge spike with the pandemic. After the pandemic, a bunch of Sharps came in, but it hasn't really gone down. So people are still bringing in a bunch of Sharps. We often get people, too, that walk in with unused medication or expired medicine, which we send them to the police department because we can't take that without PD presence. But it's nice that we're so close.
Is that the same, is that in conjunction with the police department site?
The Sharps and the medication.
Yeah.
So the Sharps they do here because then we have our med disposal ways to take them away. And then the medical or medicine is at PD.
Oh, okay.
So that's in the lobby 24/7. But maybe we'll do some digging about double.
Do you charge to trade in your Sharps container?
To trade in your, so if you bring in a hard wall laundry detergent container, so liquid laundry detergent, not pod, like not Tide Pod, because that's too thin, but that very specific plastic being the liquid laundry detergent, we accept it in that. We take that as an approved container. Otherwise, we sell Sharps containers at cost to people. So we have small and large, and I'd say 50-50. Like 50% of people tend to bring their own, and some just like the convenience of buying one here.
And do you have a limit to how much they can bring each time?
No, but if people bring a mass amount, we say, why don't you think about stopping here a little sooner next time?
Okay.
Because we have a box about this big that we collect all of the boxes in. So we can take them all and then tape it up, but it limits our pickup for that month. We haven't had that so many times, but a few times. And then just one other thing to note is 599 is the total number of flu vaccine given from the Franklin Health Department this year.
Did you give the RSV vaccine?
No.
Okay, just the flu. Okay, then we'll move into, are we done? Is there anything else on the community? No.
We can go into the communicable disease
Right, why don't we do
report.
that?
So that is the sheet that looks like this. So City of Milwaukee compiles a respiratory report for Milwaukee County, and then our public health staff here break it down for Franklin specific. So in the very far right, you'll see Milwaukee County numbers year to date, just to keep it clean. And then you'll see all the other numbers are Franklin specific. So if you just want to browse over that. Something to note is now COVID-19 is reportable when it's a pediatric death or a hospitalization. Not every COVID-19 positive case will be counted. So that's changing a little bit moving forward.
Couple questions. The 2022, is that just Milwaukee County?
That's Franklin.
Or just Franklin? Okay. And then I noticed, again, we were talking about that earlier, the RSV, they probably did not test for that in 2022?
We really didn't. Yeah, you would probably have more seen us testing for it in the pediatric population, but now we're pretty diligent with all respiratory. It's part of our panel.
Okay. So that's now added on. Okay.
Do you know what led to that change? Why it decided to become more typical in tests?
I can only speculate. I would almost think that if we went back and we started looking at morbidity and mortality in the hospitals, that we were starting to pick up RSV.
Yeah,
And then it
that makes sense.
And then we have a vaccine for adults now.
Yeah. Thanks. So we'll bring this quarterly. The start of this year was retroactive to 2023, but we meet again in April, so we'll have a nice time to come together with a report.
Okay. And we'll move into the health department program updates.
All right. So, some things that we have going on. You all are aware of that Blue Ribbon Award. So that's finally getting accepted in real life at the National Leadership Forum in DC in February. So myself, Ellen, and Megan are going for that because we also are presenting. So that is exciting. We have a session and a poster session as well. And likely one of our fire department partners are coming, and one of our school district partners will be coming to the conference.
Where will that be displayed?
Well, I don't know. It has to be in here or something. I'm not even actually sure what it'll look like, but hopefully it's grandiose and we can hang it in the health wing. We are now officially a Narcan administration testing or training site, so individuals can come in for Narcan. And Volition Franklin, City of Franklin Health Department, and Fire Department have been doing Narcan trainings in the community.
Ask, just going back to that, why don't you ask the mayor if he could post it next to the bulletin board for a couple of months, just so the
Yeah.
community can see it as well, because they're not gonna see it here.
Right.
That'd be fun.
That'd be-
Maybe you
Sure.
just ask if for 3
Absolutely.
months, it could be right alongside the bulletin board where people come in and look at agendas and stuff, they can see
Yeah.
that award. So
That's a
great
great
idea.
idea.
That's a great idea, yeah.
you get more visual out there than in here.
Yeah.
Some nice words, congratulations. and,
Yeah, something like that.
you know.
Yeah. Thank you for that
Floodlight
idea.
on it.
Yeah. A little spotlight, a little case maybe, we'll see.
Just have it posted out there so it'll be visible.
Some other things we have coming up is the AV screens that we talked about. So this year it's going to be more of a partnership than just a health department service. So health department and district staff will work alongside each other with the Lions Club to perform those. We are launching our second maternal child health daycare series where public health department staff are going we're piloting it at Jubilee, but we're going in and trying to strengthen social connection in a childhood level. So realizing that with the pandemic, that's one concern that many people have brought forward is lack of social connection. So we've been working with the daycare instructors there to both figure out how they can create lessons rooted in really bringing kids together and not just necessarily always separate from each other, just trying to bring people together. So earlier in the fall, 2 of our public health staff did a little pilot series, but we wanted to tie it more into our public health priorities and our community health improvement plan. So now they're going to be focusing on mental health or wellness, physical activity, nutrition, and community connection is our overarching goal. So they're working on that. We have Light and Unite Red Week coming up in March. So that goes along with the National Drug and Alcohol Fact Week. So Volition Franklin spearheads that, and that's when people are wearing red, and we're trying to do a cross-community event and campaign. So that's still in the works. We have our next community health partner meeting for the Community Health Improvement Plan coming up on January 18th. So that's soon, but I wanted to bring it to this group in case someone was interested in going as a Board of Health representative. That is where the community partners come together and then work on those priorities. So it's not everyone who's around the table is the boots on the ground, but it's like some people who are decision makers with their organization, or some people who are volunteers, some people that work staff or leadership level. It's like a good mix of a lot of different organizations and groups. So that will be on the 18th at, I want to say the library, but now it's slipping my mind. But we do it locally here in Franklin and bring everyone together for about an hour and a half. And we won't meet again probably for another quarter. So that's coming up. So just let me know if you are interested.
That's this month, the 18th.
It is, yes.
And is it at the where?
I think it's at the library.
I think it's at the library.
Yes,
Because I know the ones that I'm familiar with have been at the where.
Yeah, we've switched it around a bit. And also we put out an ask if anyone is interested in hosting, and we had a tremendous response. So now I think we'll just bounce up to a bunch of different locations, which is also nice to showcase. Yes, it's at the Franklin Public Library on the 18th in the morning. All right. Let me just make sure I'm not missing
Can I
anything
just
else.
show up?
Well, we'd prefer an RSVP, especially as a Board of Health member, just in case there were going to be a walking quorum.
Okay, yeah.
But I'll let you know if no one RSVPs the day before too, and you can just show up. That would be lovely. It's really nice to have diverse voices in the room, just to have a lot of different perspectives. But those are the main updates I have for us.
Any other questions, comments? And we'll go into environmental health updates.
Just one,
Okay.
as an alderman, I'm really pleased to see, and maybe it's been going on, I just haven't been aware, or the council hasn't been aware, of all the different grants that you're applying for and getting. You're doing funding from different sources for different kinds of activities. I think that's really great publicity for us in terms of what you're bringing before council. I mean, there's 2 or 3 items goes before council almost every meeting now, and that's good. I mean, I'm sure maybe it's just a funding cycle.
Yeah.
But just to get that news that there's money out there and we're going after it, and the sustainability of everything, which leads me to my sustainability about volition. You know, that's another concern. So
Yeah.
those are the two. I'm happy to see what we're doing, but in the back of my mind, I keep thinking volition.
Definitely, and I'm glad you bring it up because that's a conversation that will need to span to a bunch of different groups. So, Volition Franklin is funded on that Drug-Free Communities grant. That was that competitive 5-year grant for $125,000 for 5 years. And then you could reapply in another competitive cycle for the last 5. So we're in,
3?
yeah,
4?
we are in year
4.
8.
Oh,
We're in the second cycle, so the 3rd year in the second cycle. And Megan Conway is fully funded through that. So when the grant's no more, we need to look at a way to be able to sustain her as a part of the department and Volition Franklin leadership, really, so that we have a staff person to keep the ball moving and rolling. So Megan has been starting those conversations about how we can continue to sustain Volition Franklin. And yeah, thank you for bringing it up. I think it's important for a lot of different groups to know.
No other comments, we'll go into environmental health, pool codes.
Yes, I just wanted to circle back in case you guys don't watch every common council meeting, but it did pass in December when we went before the council with our pool code license revamp. So just a refresher, as the pool code had changed for the state, and we needed to change our license categories and inspection fees to be able to match what we needed to do for the program. So as the city of Franklin, we're the agent of the state for the pool inspections, so of the Department of Trade and Agriculture. And it passed as proposed. So formerly, we had just said, you're a pool, this is your license fee, and this is your inspection fee. But now the state is saying it's tiered based on complexity, more or less. So if you have different features in your pool, or depending on what the size and landscape and whatnot is, that changes what the rate is. So that did pass early in December. And then inspection report is just to give an update on inspections that had happened. So you'll see on your service summary chart, we did 74 inspections in Q4. The majority of those were routine inspections, so going out to licensed establishments, restaurants, and doing their on-site check. Some of them were follow-ups, some of them are schools, and then a few of them were mobile units, mostly for those winter events that took place in late November and December.
Any questions or comments?
We don't know for sure what's going to be happening at Orchard View in terms of increased inspection services. Do you have any idea or anticipate anything there? Or just
I
waiting to see
do.
what goes in there?
Well, I'm waiting, yes, because if restaurants go in, that'll be something.
Food
If
trucks.
Yeah, if food trucks are there, that's something. Also, that would have to do with inspection services and us, because if it's going to be a mobile truck that comes and goes, if it's going to be like
Station.
a restaurant with a food truck facade, that's different. If a splash pad goes in there, if a pool goes in there, that all makes a difference of our level of involvement.
It's not around the corner.
Yeah, that's something to be aware of. And that's really a trajectory of every city, I think, is that demand on environmental health staff only continues to rise. Another example of that is Airbnbs, so tourist rooming houses, and then the demand that that would have on inspecting those if the number creeps up around RNC and other events. Something to be mindful of, because in future budgets, I think we can squeak by now, and we got that grant funding to increase our .1 sanitarian to .4 again for 2024, but that need is not going away. Like, that will always be increasing as long as there's economic development or business growth in Franklin.
What would happen, like out at Saputo Cheese? What typically, I mean, how would you be involved or wouldn't you be involved? Because it's food processing. Is there any kind of thing that?
Yeah,
that-
it would
that
depend
connection
on
there?
if they're selling on site to the public.
Oh, okay.
So there's a
Not
lot
the
of
manufacturer
intricacies
or-
that our sanitarian staff. We have been involved in businesses that we've never been involved before with COVID. So that was an interesting introduction to some businesses out in the world. But everyone's business plan, what they sell, and what they do exactly is a little bit different about their touch point with our environmental health staff. But hopefully, in April, I'll have an environmental health program brief for you guys based on the work that one of our interns is doing.
Right,
So
yeah.
that'll be, it's nice to know your questions, because those are some of the things we can highlight for the public.
Motion to adjourn.
Do you have a second?
I'll second it.
Okay, all in favor?
Aye.
Aye.
Okay. Meeting is now adjourned.